Welcome to NCCI's Insights Video Edition. Thanks for joining us for this installment of NCCI's Insights Video Edition. I'm Sheila Fortson. Today we're joined by Dr. Michael Chu, Chief Medical Officer and Senior Vice President of Paradigm, an industry leader in solving catastrophic and complex healthcare challenges and for improving lives for almost 30 years. Dr. Chu recently penned an article for our Insights portal, Catastrophic COVID-19 Workers' Compensation Claims, Case Studies, and the Pandemic. He's here to discuss more about it. Welcome, Dr. Chu. How are you today?
I'm doing great. Thank you for asking, Sheila. Glad to be here.
So let's get right into it. The world has certainly learned a lot about COVID-19 since earlier this year, around about March. What has the medical community learned about the pandemic as it's continued to evolve since that time?
Obviously, we now have these data coming in, looking at all survivors as well as the people who have recovered. And over that time period, we also have learned quite a bit about the basic biology of COVID-19 virus. So, I'll go through some highlights if I may. And so, first and foremost, I think we now know for sure, I think the world knows for sure that COVID-19 virus is more than just a respiratory virus. So, we know that it's actually a systemic virus that involves multiple organs, as well as it also has the secondary effect of this hyper-exaggerated inflammatory immune response known as cytokine storm that I think has been very detrimental for the body, as you know. So this leads to lots of complications and wreaks havoc in the human body, resulting in some of the outcomes we have noticed over the past 6 months. Now, with transmission, we also have learned that that it's directly correlated to the closeness of contact and the duration of contact. So I think it's very important. There's a lot of debate about, how it's transmitted, is this aerosolized and all that. But at the end of the day, I think we know for sure now that it has to do with the closeness of contact and the duration. So just as it might be helpful for the listeners, the transmission rate to people who are within the family and the household is about 30 to 35%, while those that work for coworkers, it might be as high as 10 to maybe 12%. So it's kind of good figure to have in mind. The other thing is that I think it's really good. I think that we have learned over the 6 months is that the actual transmission of viruses actually, for COVID anyway, diminishes over time, which means that if you get sick with COVID-19 virus, then within 7 to 10 days, even though they may be symptomatic, they become less likely to actually transmit the virus to others around you. So that's a good thing because, people will have symptoms and people are thinking, my gosh, should we avoid this person or what have you, or they may feel guilty about interacting, but actually 7 to 10 days out, the likelihood of you giving the virus to somebody else really diminishes. So that's a very helpful fact to know.
And what about patient care?
I think we made some incredible progress with those severely and critically ill patients, where we've actually learned enough to really start to improve on survival. So what are those items? Well, we started to actually focus much more on utilization of the non-invasive respiratory support measures that included like using just high flow oxygen, positioning the patients to a prone position to help with their breathing and oxygenation. And really it's utilizing the non-invasive oxygenation methodologies versus the mechanical intubation. I think you heard a lot about how people place on ventilators early in the game, and actually we discovered that actually that caused more problems for the patients, and so we now have shifted pretty significantly to not using the mechanical ventilator, as long as we can. The other thing is that we have learned to treat the complications much more proactively. So proactive complication treatment would be to anticoagulate the patient so that we really reduce the frequency of blood clots occurring in the body. So reducing the pulmonary embolism, the DVTs, and in fact, clots that form in the large blood vessel that could create strokes and limb ischemia and a heart attack. So we've done really good about aggressively treating the anticoagulation to make that, first and foremost, protective of the patients. A few other points that I want to make that might be of interest is that we now know that reinfections from COVID is possible. So we used to think that maybe if you get COVID and you recover, you'll be okay, going forward or forever protected. But I think there are some cases that we have now identified that does confirm that reinfections have occurred because of mutations that occur with the COVID-19 virus across the globe, although it's very, very infrequent. So I want to emphasize and kind of reassure people that just because that reinfections can occur, it's not going to be a huge impact. But I think people need to know that reinfections can occur. But if you have immunity, you're pretty protective for at least 3 to 6 months, definitely after getting the infection. So I hope that helps you.
No, it's very, very helpful and certainly a great deal of insightful information. Zeroing in specifically on workers' comp, how might the pandemic impact workers' compensation?
Yeah, it's another great question. So, from my perspective, I think the COVID-19 pandemic has already affected workers' comp in three big ways. I think first is that obviously, because of COVID-19, the frequency of claims related to COVID is going to be impacting workers' compensation industry. But what's interesting is because of the reaction to the COVID-19 pandemic, where everything was closed, as you know, Sheila. And people were furloughed or sent home, and people weren't working. Actually, I think from an aggregate level, I think all the other claims associated with workers' compensation may be declining or may have declined. So I think going forward, the question is how much of the workers' compensation industry has been impacted by COVID. It can be looked at in two ways. One is from COVID itself, and secondly, I think is the impact to all the other claim that would have normally been expected in workers' compensation. So that's the first, I think, category. The second category, I think that I'd like to talk about how it impacted workers' comp is actually the actual care delivery process. Where because of all the closing down of services, both in the hospital as well as other industries, I think it has tremendously impacted the access to care that's required or is needed by people. So I think there is definitely we have noticed definitely a delay in access to care, both for workers' compensation related injuries as well as the regular health conditions that are out there. The other component that I think has impacted that is that people are actually afraid to go to their doctor's office and to the hospitals because they don't want to catch COVID-19 either, by putting themselves out in this kind of environment where I think people are concerned that there could be a higher risk of getting COVID because you're in the healthcare environment. So I think definitely the delay in care, access to care will be a factor going forward.
You mentioned some delays and some folks seeking medical care because of the pandemic. Has there been any impact to the use of telehealth, telemedicine because of that?
I'm thinking that telehealth modalities that has been somewhat slow in the adoption is going to be changed forever going forward. Because I think that the industry have shown that telehealth platforms have been very effective in at least keeping the care delivery process intact as much as possible.
You mentioned some promising new therapies for hospitalized COVID-19 patients. What are they and why are they considered to be so promising?
So I think the first category of drugs that have been shown to be promising is what you heard of in the news, the remdesivir, which is a drug that is like a nucleotide analog that actually prevents the viral replication within the cells. So, the cells unfortunately, they become a manufacturing company for these viruses within the cells that the virus is attacked. And what remdesivir does is that it makes the virus in a way that it becomes inactive. So that's one category of drugs. And as you know, the remdesivir has been shown to be beneficial, at least in the inpatient side, where it seems to reduce the duration of time that patients are being needed to be in the hospital. The other category of drugs I think is very exciting is the monoclonal antibodies. And monoclonal antibodies have been around for a while, but these are manufactured antibodies outside of the body by pharmaceutical companies that can be given to the patients who are infected with COVID-19 early in the game, so that actually it just takes the viruses, neutralizes the viruses within the system before it starts to attack the cells. So it actually prevents the viruses from entering the cells. And I think this is really a fascinating and exciting therapeutic modality, in that if someone gets infected or gets exposed to COVID-19, they can go ahead and be given these monoclonal antibodies ahead of time so that they will not get ill.
In your article, Dr. Chu, you shared 2 catastrophic COVID-19 case studies. Can you talk a little bit more about one of them and also give us some of the key takeaways from those case studies?
I'll start with actually key takeaways. I think it's important to note that COVID-19 cases is something that can cause catastrophic impact on I think the on patients. Even though I think, again, going back to the premise that majority of the people who get COVID-19 will be experiencing a mild to moderate symptomatology, I do think that it's important to know that people some people will experience a catastrophic complication that results in severe disability. And so the first case, obviously, I want to talk about is a young gentleman who actually had no comorbidities, very healthy, 31-year-old, and the fact of the matter is the individual probably didn't think that if he got COVID-19 that he would experience a terrible outcome, but that was actually the result, unfortunately, that occurred because of a thrombotic complication that resulted in brain infarct and lots of neurological complications. And if you look at the history and the sequence of events, I think because he was young and healthy, I think there was some delay in getting his symptoms assessed. He kind of waited at home and thought he'll get better, and I think that it allowed a certain period of time to go by before he started to experience the complications, which caused him to go seek assistance from a healthcare facility. But I think that if he was seen sooner, I always feel that there's probably something more that could have been done to intervene to may have potentially somehow impacted the consequences of the infection. So I think the takeaway from my perspective is that even though you may not have risk factors, even though you may think you're healthy, I think if you start to experience symptoms that could be related to COVID-19, I would recommend that there is a high priority to being seen by a medical personnel and seeing whether there's anything that needs to be done as a way to better triage your symptoms and get better treatment.
You can find Dr. Chu's full article in our Insights portal located at ncci.com/insights. Dr. Chu, thanks again for joining us today. Very insightful, very insightful.
Thank you for inviting me, and pleasure being here. Thank you.
Be sure to subscribe to channel NCCI here on YouTube and turn on your channel notifications. Follow us on Twitter at NCCI for real-time valuable updates. Join us next time when we discuss the issues at the top of the workers' comp agenda from the source you trust.